Good afternoon. I'm Kathy Boffman-McLeod. I'm the director of the Adrienne Arsht Rockefeller Foundation Resilience Center at the Atlantic Council. If you found our event today, you know the Atlantic Council is an almost 60-year-old foreign policy organization with a mission of shaping the global future together. We are excited to join you, to host you today to explore the solutions and experiences of cities and city leaders, and I'll get quickly to introducing our speakers. I want to give you a flavor for the Adrienne Arsht Rockefeller Foundation Resilience Center. Our founder, Adrienne Arsht, she is an impact philanthropist and a businesswoman with a passion for resilience, and particularly for resilience of individuals and in cases of crises, and how we all withstand and survive and thrive in the face of all that we are facing today. Turning to cities, you may know that by 2050, 70% of the world will live in cities. And the UN predicts that half of that population will live in a slum. And when you think about the state of the world and the crises that we face, cities are at the forefront of handling all that brings. And when we think about cities, we are thinking about cities and resilient cities and the Rockefeller Foundation's creation of 100 Resilient Cities. And we are also privileged to have the support of the Rockefeller Foundation as we and our sister organization, the Global Resilient Cities Network, with whom we are partnered, build on the legacy of 100 Resilient Cities and the solutions and the strategies and the movement that was born by that program. I wanted to take note that Rahm Emanuel has written a book and has been in the news talking about cities. And he says, as national governments have become weak, paralyzed, and dysfunctional, cities and their mayors have filled the vacuum. In many critical areas, they are now the ones actually getting things done. And so in this line, as we think about the crisis we face today of COVID-19 and cities as the front line and the solutions that we need to identify and implement, and at the same time maintaining hope and the social cohesion that is necessary, I'm reminded of Fred Rogers, Mr. Rogers of public television. And he always recalled a story that his mother advised him when in a serious situation or a crisis to always look for the helpers. And that is when times are chaotic and there are certain to be people around us who instinctively and selflessly look out for the needs of others. Today, we are privileged to have with us two great helpers, Mayor Mitch Landrieu and Mayor Dan Gelber, public leaders working at large scale at the local level and with decades of public service for their constituents and for all of us. And so I'm very pleased to turn the microphone and the camera over to Mayor Mitch Landrieu. Thanks so much for being here, Mayor.
Kathy, thank you so much. And it's so great to be with the Atlantic Council and, of course, our wonderful friend and founder, Adrienne Arsht, in partnership with the Rockefeller Foundation around the whole issue of resilience. So I'm thrilled to be here. I'm reminded at this very sober time of Thomas Paine's statement that these are the times that try men's souls. And there's no question about it. We're in a very, very difficult moment in the world and, of course, in the United States of America. This virus that we're now fighting knows no geographic boundaries, and it is indiscriminate in who it touches. It has made itself clear that it is going to go everywhere and anywhere that it can, unless and until we stop it. And that is the moment that we're in. Pandemic is actually too small a word for it, but that's where we are. And I'm looking forward to the conversation. But as a general rule, being prepared for what may come your way that you can't see is very important. And that's true whether it's a terrorist attack, a hurricane, a tornado, wildfires, and of course now this pandemic. It is fairly clear that the world writ large was not adequately prepared to see what has come. And we now can look back on that, but right now we're in the moment of immediate and emergency response, which is of course being led by the mayors of America on the ground in partnership with their governors and in attempted partnership with the federal government. I would observe this after having served as a lieutenant governor for 6 years and the mayor for 8, through the times of Katrina and Rita and Ike and Gustav and the recession and the BP oil spill. There are some and more. When are the locusts coming? There are some lessons that are important to learn and to work on. One of them is clear command and control between and amongst the different levels of government, horizontally and vertically, clear communication and clear coordination. We can see those things not playing out well as we respond to this virus. Mixed messages coming from the White House about when and how much. Governors of different states attempting to do or not do certain things in the same time. Notice the difference between the admonitions that Governor Cuomo has issued in New York versus the governor in Florida, or, for example, the governor in other parts of the state. The mayors speaking to what's going on in their respected areas. The most important lesson that mayors try to communicate to their citizens is, please listen to your governor and your mayor, who are the people that are closest to the ground and most often in coordination with each other, because they know what's happening in their respective jurisdictions. They really are on the front lines in a way that people on the federal level are not. So to be clear about this, the mayors are the ones that are actually going to the emergency rooms right now, talking to the doctors that are actually having their hands on the individuals who are being treated. The mayors are responding to phone calls from mothers of the doctors who don't have protective personal equipment. The mayors are the ones who are setting up the morgues, who are working through setting up the hospital beds in the convention centers, and they're doing it with all their first responders. And if there is no clear command and control, clear coordination, clear communication, then you will always have a failure somewhere along the way, and more people will suffer than less. And so as we look back on this, we will see clearly where there were great successes and where there were not. To the point of Fred Rogers, it is absolutely clear on the positive side of this thing, as there is in every catastrophic event, that there are miraculous examples of human beings doing unbelievably courageous things in spaces that we do not expect. And of course, that outpouring of support and American spirit, and I'm sure this is being manifest across the world, angels among us just come from seemingly nowhere and do things that should not be expected of our fellow human beings. This next thing I would say is, right now, we have to, what I would call, and this is a tough statement, brace for impact. The next 2 weeks in the United States of America is going to be hard to imagine how difficult the consequences will be. The president yesterday, relying on evidence coming from the researchers, indicates that on best case scenario, 80,000 deaths, moderate to worst case, 240,000 deaths. And if nobody listens, it could be exponentially higher. Our country has not received a blow like that in our lifetimes. And how we respond to that is going to be very difficult. It's going to challenge us. The third thing I would say is, and this makes it a little bit more difficult, is that while we're looking down, fighting hard, this virus that's right in front of us, we have to take a minute to look up, because we're not in hurricane season yet. And we have to still be prepared for other things that might come our way that we might not be prepared for, or worse yet, that coupled with the virus actually coming back. So we have to think about that. And then finally, when, God willing, we get through all of this, and we will, and we come out of the other side, that is when we're going to have to refocus our attention on what resilience really means now. Because every time we think we're ready for something and something new comes our way, we have to begin to prepare for that in expectation that we will see that again. And resilience, defined specifically, is preparing ourselves, social cohesion, financially, spiritually, emotionally, technologically, for what might come our way, so that when it comes, we're not hurt nearly as badly as we could have been had we not been prepared. And we're much more capable of responding much faster. Clearly, we have a long way to go before we get ourselves in the position that we want to be in. But as we speak, we're in this fight now. We're right in the middle of it. We have to focus on that, but we have to look up a little bit, and then we'll look back and get better for the next time. But certainly another next time will absolutely occur.
Great. Thank you so much, Mayor Landrieu, former mayor of New Orleans. And now over to you, Mayor Dan Gelber, mayor of Miami Beach, Florida. Thank you.
And thanks to the Atlantic Council and Adrienne, who is one of the great philanthropists and friends of our community. And we're a resilient city with Rockefeller, so they've been terrific for us as well. I'm going to go to a job I had when I was a much younger man. I ran the U.S. Senate's Investigations Committee for a few years under the leadership of Sam Nunn in the 90s. And the challenge that we confronted back then was after the breakup of the Soviet Union, Senator Nunn, Senator Lugar, and some other pretty smart guys and women believed that the nation really wasn't prepared for the next big thing. And so they tried to reorganize us. They tried to let everybody know that the Cold War compartments that everybody worked under just weren't going to be good enough anymore for the challenge that the nation was facing. And so we spent about a decade trying to ring a bell to let the world know that what we called subnationalist groups might one day be able to kill thousands or more of our residents and our citizens because we just weren't talking to each other or creating resiliency among our national security apparatuses. And of course, 9/11 happened, and then we immediately changed all of those kinds of relationships and changed the institutional culture of so many of the organizations, both public and private, that we rely upon. I think we do hit these moments in the community and in the nation's experience where our failures are revealed to the world. I was speaking to my city manager this morning, and I said, as we were going through all the issues of the day, I feel a little bit like that. And I think it was an I Love Lucy episode where it's a conveyor belt, and they're trying to take care of the chocolates or something, and they become overwhelmed immediately. I said, I feel like the decision making here is like one of those conveyor belts, and we're trying to get it right as it goes by us, but we don't seem as prepared as I would like. And so for me, I think that while there'll be a time to look at this forensically and say we need to change a lot of things, unfortunately, a lot of the things we need to do on the front end weren't done. Certainly in healthcare, simply because it's hard to convince people to take action. It's hard to convince Washington to take action, or even any kind of governments to take action for a threat that is only imagined at this point and not one that is being felt. So to a great extent, I think what we're unfortunately feeling is the sort of the failure to have those resiliency protocols in place. And what we're seeing in my city, for instance, is I found the greatest frustration was that I was born and raised in Miami Beach, which is, if there's a city in the world not built for social distancing, it is my city. People literally come to my city to dance and hug, to have gatherings, to go to our many venues, our dozens or hundreds of restaurants and bars, to walk down our streets in crowded places. We are not like New Orleans, I imagine, a city built for social distancing. So for us, in late February and early March, when we're getting all of the, you shouldn't have a group of 500 or more, we're like, we don't have anything less than 500 or 250 or whatever you have. I mean, it's like a different language coming to us. So we began to sort of just say, okay, we really can't deal with the CDC guidelines because they don't apply to our little area of the world. We have lots of commercial residential. We have lots of seniors in facilities, and they're all together. So for us, it was really sort of feeling like we had to do it ourselves. And so I think we're the first city in Florida to do a shelter at home. We started to close our beaches. Those are not typical things that a local mayor would do without somebody else saying, without giving it a blessing. And I'm Jewish, so I'm sorry to give that blessing, but that's what, what I mean. And so, and I think there'll be a moment when we'll look back in this and say, what do we need to do better? And that'll be great, because that's what usually happens after this. But the problem right now is figuring out how to simply not react to what's coming. And the reason why it's been so hard, it's almost like this virus was specifically created to test all of our inadequacies, in a sense that it has this inchoate period where it spreads without us knowing it. So we're always weeks behind. We are now feeling the deaths in Dade County, where I'm from. I think we have 17 deaths as of now. 17 people have succumbed. And we have almost 2,100 or 2,200 positive in our county. Clearly the worst by far at this point in the state of Florida. But it was really 2 or 3 weeks ago when all of it happened, and we had one at that point, or even less, we had no one who had passed away. So there was no political will to do that. And I think if you talk about resiliency, resiliency is about preparing for something that's perhaps anticipated, perhaps not, but getting all of that private and public entities and infrastructure prepared for this kind of thing. We are prepared for hurricanes. I sat, and my dad was the mayor of my city during Hurricane Andrew. So I sat with him. I was a young federal prosecutor at the time, as we were watching this thing come at us slowly, but preparing. But we prepare for hurricanes. We see them. We know them. This is new, and it is testing the limitations of all of our structures, both private and public. And unfortunately, we're going to learn terrible lessons at the pain of many both lives and economies. But at the end of the day, I'm very proud of our residents, because I think they're approaching this with a the way they should. But I do feel like we walked into this with one arm tied, or both arms tied behind our back.
Thank you very much for that. Let's turn to Mayor Landrieu for just a minute, and I'd like to talk about the resources that you have as mayors and as local leaders. You were the president of the U.S. Conference of Mayors, and you think about how do you quickly advise each other. I know that the Bloomberg Cities Initiative is holding conference calls every week to train mayors as to how to handle these crises. And so I'll ask you that, what's the role of those types of organizations, having been in that spot? And then also, what are the things that you can control as a mayor, and what are the things you can't? And where's the interplay there? Because there's a lot of expectation from your constituents.
Well, thank you very much. I'll take those in the order that you asked them. First of all, mayors have a tremendous amount of respect for each other and are in constant communication. And as Ram would say, we have license to steal from each other, the good ideas that we have. At the gathering places where we meet, U.S. Conference of Mayors, National League of Cities, National Association of Counties, wherever they are, we have a really incredible sharing spirit. And we don't talk to each other like the folks in Washington talk to each other. We never have partisan conversations. I haven't been in all of the conversations I've been in for the 8 years in all the national conferences. We're usually thinking about what is the best way to solve the problem. We don't talk about anything other than what's the right solution to the problem. There's no philosophical discussion. And so we are freer on the local level to be able to get to answers, whether they're big government answers or small government, private sector, not-for-profit, whatever they are. And so all mayors pride themselves on being problem solvers and sharing with each other. And that has gotten even more ubiquitous in the last couple of years after 9/11, because the Homeland Security issue, the how do we respond to hurricanes issue, how do we deal with debt, all of those things. We also have had Mike Bloomberg, who, to his incredible credit, decided that after he left government, he was going to use a huge amount of his philanthropy to set up a platform for mayors in America to talk to each other. I participate every Thursday in a meeting that Bloomberg Philanthropy has that they're invited. I think we had 220 mayors on the phone the other day to start thinking about, what are you doing in your communities? What do you need? Who's got or who has responded to something that you've dealt with? And so that's really good. The next question it changes from city to city, but essentially the mayor is the commander in chief of their governmental entity. If it's a strong mayor system, not all of them are, but even in a weak mayor system where the mayor is the head of the council and there's a city manager, those individuals are the commanders in chief. They're responsible for their police department, their fire department. They're responsible for all of the departments that respond to fundamental issues of water, of safety, of all of that kind of stuff. And if they've been paying attention at all in the last 10 years, they have some level of Homeland Security apparatus, oftentimes run through their fire department, but sometimes a separate entity, to marshal all of their resources towards fixing a crisis, whether it's a water crisis, or, as I said, a hurricane, or some kind of public safety issue, and now with the virus. And in this instance, there is usually an incident commander. So if it's a fire, it's the fire chief. If it's a public safety thing, it's a police chief. If it's a health thing, it's usually the public health officer. Every city's got different resources, but like New Orleans, I guess just like Miami, we invite people here to hug and to kiss and to eat at restaurants and to drink and to have fun. We have a massive convention center. So right now, because our hospitals are overburdened, we are now opening up a 2,000 bed hospital in the convention center where we normally have conventions. And so the mayor and the governor have authority and control over that structure, but in partnership with FEMA and the National Guard are now converting the convention center into a non-acute care hospital so that we can free up ICU beds, et cetera, et cetera. That's why the coordination with the federal folks is really critically important. And of course, there's nothing more urgent in the issue of coordination than the acquisition of ventilators. And you see the governors expressing frustration of having now to bid against each other for a short supply of ventilators rather than having so the federal government has certain powers, the states and then the locals. If they're all aligned, you have capacity, you can take care of people. If they're not aligned and you don't have a capacity, people are going to get hurt. And figuring out how that lines up, we're actually watching that happen in real time. And you can feel that we're actually out of sync today. That's why you hear mayors and governors saying, I'm okay until April, whatever the day is, 4th, 15th, 20th. And then other folks are scrambling to get the assets to where they need to be in time to do what? Number one, save life. That's always the number one thing, not the economy, but to save life, even though I understand there's a balance that people are talking about there. And then secondly, to save property. And then the mayor has the responsibility of being the one who makes the clarion call to the governor and to the president about what happens in their community and to speak with force about it, which is what all the mayors in the country I know are trying to do, irrespective of what state they're in.
So I want to come back to a couple things in that when we get to the Q&A session. But Mayor Gelber, let me ask you, you talked about the challenge of the city as a place where it's hard to be socially distant or physically distant. I want to ask specifically about the elderly population of Miami Beach. That seems like a particular challenge. I know your community probably has a pretty high percentage of elderly folks.
Well, it's interesting. We're not as old as people think we are. I think our average age is in the 40s now, but we definitely have lots of seniors. Some of them are in residential communities. And I guess the point is, if you look at the country, or you look at a state, there are going to be areas in a state that are hotter, in a sense that there's more peril there because of the way it's set up, its urbanization, its traditions, and what it does. But even within our city, there are areas that are hotspots. Yeah. So two areas we have really had to deal with are our seniors and, frankly, our religious community. Mm-hmm. Our seniors, we have wonderful programming for them. We have done, that's the proudest thing I am about our city. We take folks, many of whom come from countries, they don't speak English, but they are so grateful for all that is around them. And we give them dances and bingo nights. I think they are just amazed at all the things you do. And we love it. And we all know them. We know them by name. We know their places. Stopping them from doing that has been difficult. They love to go to Publix and they love to shop. They love to see each other. They're a hugging group. And we've had to figure out how to stop that. We have a free trolley service. 500,000 people use it every month. We've had to stop it because we don't want people on trolleys who are seniors with tourists who are still sort of somehow around, especially since so many New Yorkers are coming to our community. So we have reached out to them. We've told them to stay at home. We're taking care of their meals. If they've got pharmacy issues, we're addressing that. We give them 3 numbers to call if they need something, and we send our firefighters. We have a COVID unit of just firefighters who are separate from all the others who are going into these senior places and are talking to people and making sure they have what they need. But that is the tinder in all of this. One of these centers, so for me, I always describe it this way. In our general population, we're in risk management. In our senior communities, we're in risk elimination. You can't check boxes and say you've told people to do something. You have to sweat the details and make sure you are. Now, I'll talk about our religious community because, especially in our Orthodox Jewish community, we've been struggling to really send a message to that community that they cannot have any kinds of religious ceremonies, even private at-home minions, where 10 people will show up from different families. We've and the rabbis in that community have really come forward and tried to create a sense of pressure on everybody in that community to not do that. So it's been really quite a challenge. But I think we're, look, I'd like to say we have a handle on it, but I don't. I stay up at night worried most about our seniors.
Yeah, thank you. So let's switch gears a little bit. I want to talk about the financial resilience of a community. So much of this in the resilience efforts to figure out how to pay for, plan for, and understand what these crises cost us. Just looking for a perspective from both of you, and I'll come back to you, Mayor Landrieu. Where does the money come from to pay for the things that Mayor Gelber just mentioned? How do you pay for that?
Well, I want to just go back for a second to what Mayor Gelber was talking about and then address the financial issue. New Orleans, we're having the same exact issues with seniors on an issue that's going to get a little bit more acute. And Mayor, I don't know if you're having this problem, but with food security, how to actually get food to people at home safely. And food security is going to become a big issue in the next couple of weeks. I know we've all been focused on PPE, ICU beds, ventilators, et cetera, but we have to think about the supply chain of food as well, which is somehow linked to what the recovery packages Congress get passed. Right now, because this is not a hurricane or et cetera, we have electricity, we have water, and the private sector is feeding everybody who can go to the store and buy food. But our school systems are providing food through the free lunch program, and we have to make sure that we get food to seniors who are shut in. And the mayor said something that's just so important. He says, we need to sweat the details. That's what the mayor has to do. Yeah. Somebody up here can set this broad policy, yeah, we're going to have food, but he actually has to get it to that door. Yeah. And there is a lot of distance, as President Clinton used to say, between the lip and the cup.
Yeah.
and so, Mayor, I feel for you on that. Secondly, in our religious services in New Orleans right now, in Louisiana, the governor is having a tremendous difficulty with the number, in particular, one Pentecostal minister who insists on continuing to have church service. And it has gotten to be a really complicated, difficult issue to deal with the battle between the First Amendment right to assemble, but at the same time, the governor's authority to protect everybody's public health. That's not an easy thing to actually physically manage. And we're not fully through those very, very difficult specific times. To the payment side, of course, this is a really complicated issue. So as we're worrying about the health and safety, first thing, everybody stay separate. Second thing, get emergency responders to the ground with the nurses and doctors doing what they're doing. The economy can't just completely disappear and everybody's out of work. And what's that going to look like when we finish? And by the way, how's a city going to continue to pay its workers if there are no tax revenues coming in? So Miami, just like New Orleans, our entire economy is kind of supported by tourism. And so there's going to be a catastrophic financial consequence. The only thing that can help this is the federal government stepping in and continuing to pass robust recovery packages. We've had 3. We're just at the beginning of this. There's no question that we have a much, much longer way to go. Now, on this, I'm a little bit more hopeful and optimistic at the moment, because even though the Democrats and Republicans are fighting over stuff, it seems to me that the president and Congress is in sync on the need to really do everything they can to help financially sustain the economy, at least in the short term. I do think, however, and I'm now relying on experts that are smart about national security and world affairs, that the United States isn't in this in isolation, that other countries that are going through the same thing and the amount of money that they're having to spend, the amount of debt load that countries are carrying, the amount of debt load that cities and states were carrying before this is going to be a massive issue that we're going to have to think about going forward. Now, as crazy as that sounds, my next statement is a little bit more crazy. I'm not sure we can worry about that today. That maybe be like on Monday. Today, really, I know mayors are worried about ICU beds. Yeah. They're worried about ventilators. They're worried about PPE. They're worried about getting food to their seniors. They're praying another catastrophic event does not hit us while we're watching this. And then that is like a medium short-term problem on the finances. And I know people are paying attention to that. At the end of the day, cities and states are going to have to get money from the federal government, whether we borrow it, or manufacture it out of thin air, to be able to sustain the employees that we need, because we don't want cities and states laying off all of their employees. Actually need to do the work to protect the citizens, whether it be police, fire, whoever, which we had to do, by the way, after Katrina, and it was very hard to recover from.
Yeah. Mayor Gelber, do you want to respond to that?
Yeah, I mean, it's interesting. There are a lot of voices out there that are saying, well, we've got this backwards. It's the economic issues we should be concerned about. The countermeasures are worse than the virus themselves. And for me, I have, my view is sort of simple in that this is a healthcare crisis more than anything. And so, I always hear from my residents every time we do a countermeasure. I describe it like Goldilocks and the Three Bears. That some think the porridge is too cold, some think it's too hot, and some think it's just right what we've done. And no matter what we do, close the beaches. Some people say we should make it even more closures, and some say, why are you doing that? But at the end of the day, the advice we've been following is the unanimity in the healthcare community, and they're the ones who I think we have to follow. So when you're dealing with lives, you really just can't say, what can I afford to do right now? It sort of becomes, there's clarity, I think, in local government in a sense that we instinctively prioritize what we need to. Now, what's the new normal going to be? I mean, I think the mayor's exactly right. There's a cascading financial impact to all this. We had a meeting this morning, nobody's parking. We don't have parking revenues. Well, our bonds are tied to some of our parking revenues.
Right.
So what do we do about that? And we're a healthy city. We just had a little extra money. We put another 20 million into our reserves. We'd like to have 4 months of reserves for the city. Those are all going to be challenged, obviously, by what's happening right now. And so for us, there has to be some recognition, especially for a city like ours, which is the tip of the economic spear for the region, if not the entire state. We have to be up and going because we want people to come back to the community ultimately to visit, to spend money, and to help our businesses and our state. And so the bill that came out recently didn't include cities of under 500,000, which I think was a big mistake, because cities of under 500,000 can do a lot of different things. Ours, I have a relatively small city. I have 95,000 residents, but I have 10 to 15 million visitors every year. So where do we fit into things? And that has to be accounted for. I'm optimistic that the federal government's going to get together on this, because the pressure from the public is so immense to get something done. I don't think I'd want to be the congressman standing in the way of that train right now. But I've never been. I guess hopefully, I won't be surprised.
Yeah.
Kathy, can I just?
Of course,
Mayor, I want to take a minute here and thank you, because not every mayor in America is that clear about what their priorities are, and some mayors waited longer than others. Mayor Cantrell in New Orleans, like Mayor, right away. If your priorities are right, your decisions follow. And in these instances, saving life is always the first priority. Not that there's not an economic consequence, but for most mayors that have been through this, and governors too, always the first thing is to do what is necessary to save life. And when you do that, notwithstanding the fact that you get huge amounts of pressure, listen, he's the one that's on the ground. And as he told you, no matter what he does, he's getting hit in the left side of his head or the right side of his head, depending on who's suffering, but he made the decision, but he's on the ground, and people see him at the grocery store. They see him at the cleaners. They see him getting out of his car and going to his home. And believe you me, they're giving him a piece of their mind, right, Mayor?
Every time. I'm afraid to go to Publix for a few reasons right now.
I really want to commend you for making that decision early on, because it was clearly the right one to do. We always remember the mayor in the little town of where Jaws, took place. It was like, we're not closing the beach. And,
Amity.
There's a huge amount of pressure not to do it. So I don't want to take a minute to just take for granted what you did there. It was really important. And I do think Congress is going to back up cities on this. After Katrina, when I took office, we had a $100 million hole in our budget. The city at the time had to lay off almost all of their employees. It's so hard to come back from that without financial support. So I'm prayerful that the feds will step into that as well at the appropriate time.
Yeah.
Great, thank you. I wanted to shift, and you've touched on it, but it's such a strong presence in all of the stories of communities that are coming together, is that social cohesion, the social fabric, and the idea that communities that have that social cohesion are those that survive and thrive the best through all of these things, including this. And we're seeing, as you said, Mayor Landrieu, so many stories about this. And just wanted to give you all a minute to comment on that, the pockets of New Orleans or pockets of Miami Beach where you see people coming together and where the fabric is really strong for that community. That social cohesion is such a driver for people getting through these things okay. Any thoughts on those aspects of your community?
I'll just start. It's I remember during Hurricane Andrew, and my dad always thought this, and my dad was a guy who served in the Army. He just died last year at 99. He was in the Army Air Corps, and he said he was going nowhere in life until World War II, where the entire country faced this common challenge and somehow leaned on each other and emerged better for it. And Hurricane Andrew was the same thing. The worst in nature brought out the best in people. And I think despite all the anxiety and fear in the community, we still see that everywhere. Even in the littlest of moments, we have a boardwalk we've kept open. People go there for their exercise and they separate one another, and they're incredibly polite, incredibly thoughtful, even in the little things, but also bigger things. Even people who are going out of business will call and say, I have a restaurant and I want my food to go somewhere. What can I do? Everybody is calling to say, what can they do? We have senior food deliveries in our city, not just the ones that are there. Everybody is so aware of the fact that they're in this together. So, the spirit of our community, because it's a community where we're all outside all the time, and we have all these things here that people come to our city for, but frankly, we love. We love going to the Arsht Center to see a show. We love going to Soundscape Park to sit outside and watch the New World Symphony. We love going to our parks and all these other places. And I always say, I don't care what your community is, whether it is a Pilates class or a dog park, you have a right to your paradise. And so we have that. And that's what's sort of carrying us through it, I think, because people are accepting a lot of these challenges and they're not happy, but they're polite about it, almost to the person. And we are trying very hard to use that because it is what's going to bring us through this. There's no question we're going to emerge having seen the best of us through this crisis.
Yeah,
I agree with everything the mayor said. New Orleans is very similar. The people here are, because of just our history, we are very tough and very resilient, but we also reach out to each other in good times and in bad. No question about that. And you see, again, as I've said before, angels among us, and people are being gentle with each other. They're being patient and they're being kind, but their patience will be tested. There's no question about that. However, to the broader issue, when you are trying to prepare for a hurricane, you think, how am I going to build higher levees? Mm-hmm. How am I going to rebuild the coast so the storm surge is not high? From a terrorist attack, how am I going to build a homeland security network? And those are usually physical things. Mm-hmm. So it is absolutely true that you will notice that communities that had tight social cohesion responded and suffered through very difficult times than those that did not have social cohesion. In other words, as the mayor said, in the worst of times, that's when we need each other the most. And the more people know each other, the more connected they are to their families, to their neighborhood, to their senior centers, to their community groups, to their ball clubs, et cetera, et cetera. It gives them the ability to reach out more quickly to extend that common hand of humanity. And there's no question about that. So when we get past this, and we will find a way to be better for it, when we look back on it, mm-hmm. we will say to ourselves, well, if we want to be more resilient and we want to be more prepared, how do we find a way to be cohesive in times of peace? And what we're going to see, unfortunately, is that there's a divide in the country between people that have and people that don't have. Who's got health insurance, who doesn't have health insurance, who lives close, who lives far away. And we're going to be able to start kind of asking ourselves, well, what can we really learn? And what are the lessons that we should then use to correct going forward? That's going to be a much more difficult conversation. I think that we're going to find out, at least I believe, that we're better together than apart. I think that, this whole notion of e pluribus unum, out of many we are one, that is absolutely true. And that now you see this virus, and this virus doesn't discriminate. It's hitting everybody, and it's going everywhere.
Yeah.
And so hopefully we will take a minute to learn the lessons we're supposed to learn, see what has been put in front of us, and then adjust ourselves accordingly. And I'm hopeful that we'll be able to get there.
Let me just take a minute to remind folks that are participating that you can submit questions in the chat. So we're going to finish our back and forth here for about another 10 minutes, and then we're going to take 10 minutes to take your questions. And so thanks for submitting into the chat. Mayor Landrieu, let's go back to that for just a second. You know, you recently had a piece in USA Today about equity and about the fact that the virus does not discriminate, and yet the virus is exacerbating underlying issues of poverty and inequity. And I just wondered if you could talk about that for a minute. And Mayor Gelber, I'd love to hear about your thoughts about that too, for your community and for the state of Florida too. I know you have perspective on all of it. Just how important that is, because as the hurricane season comes behind it, and that is another way that we see the inequity of our communities, it's an important issue, and we want to be building new muscle memory for how to be ready for the next one. And I think that is going to get bigger and bigger, and we're going to have to take care of that in some way.
I think that I can say without fear of contradiction that catastrophic events magnify what is. Those things that are beautiful and rich and lovely, the way people run towards each other, run to the fire. I mean, it just explodes off of the page and gives you great hope and great joy. But it also points out the deficiencies as well. Wherever there's a crack, the crack's much bigger. It also is a complete reflection of people's personalities, a city's personality, a nation's personality, and our leaders' personalities. And you see that manifesting itself, you know, on TV as we speak through the way different leaders respond to this. And so it will magnify the inequities that we have. There's no doubt that, for example, when Katrina hit New Orleans, 17 feet of water hit every community. But the communities that had home ownership and had insurance and had generational wealth came back much, much faster and were in a better position to get further ahead. And those that did not, and came back slower and came back less, and it destroyed generational wealth. You'll see that in this instance with healthcare. Those folks that have access to healthcare and those that don't. Transportation, how to drive someplace to get a test. Well, if you only can move around through public transportation and you don't have a car, you can't get there. The same thing is true with food sustainability. And if we care really to look back at it, and it will be painful for us to do, it will prove the point once again that income inequality is a major driver of social dislocation, which is the opposite of social cohesion, which is the thing that builds resilience. And so I think we have to be attentive to that. The level of poor people in this country is way, way higher than it should. And as General Honore said after Katrina, this is his quote, not mine, when it gets hot, the poor get hotter. And when it gets cold, the poor get colder. And when it rains, the poor get wetter. And so the big idea is to try to find a way to lift people out of poverty and help them build generational wealth and give them access to healthcare and to education so that when bad things come, which they always will, that they're in a much better position like everybody else to respond to it, which of course alleviates the need for rescue and response.
Yeah.
I think the mayor can tell you about evacuations. When a hurricane comes, you know, if 95% of the people evacuate and the first responders only have to care for 5% of the people, you can do that. But if only 60% evacuate, then you can't take care of 40%. The same thing is true in responses to catastrophic events relating to poverty. And that will manifest itself very, very clearly, unfortunately, over the next couple of months.
Thank you. Thank you. Mayor Gelber.
Only, I think that was a pretty magnificent rendition of what's happening. The only thing I would add to that is it's healthcare and income disparity, but it's the bounce back that I think we're going to have to really see. In other words, right now we're trying to help everybody. But at some point when the dust settles, there are going to be people who don't have the ability to resume a life that they had before because they don't have a job or things like that. And I think how the new normal for some people may not be what it is for others. And that's going to be most magnified in the aftermath of this, when people who've lost their jobs or businesses can't really get it all back. And you've got a whole class of people who feel left out or outside.
I completely agree with that, Mayor.
So I've got two questions, and then we'll turn to the questions that are coming in. One is, as we have heard, as the numbers are projected in terms of the deaths in the U.S., the feeling of where we are now is going to change. You've both said that we'll know. I know personally people that have died from COVID-19. Many of us will. It feels different when we have so many deaths and the stories coming out of the hospitals and the healthcare system. And so I wonder, from your perspective, how would you recommend for you, Mayor Landrieu and then Mayor Gelber, what are you going to be doing through that period? It's going to feel different, and the tenor will be different. And it's, to focus on recovery, which we're beginning to talk about, but we're about to go into a pretty dark period. And some comments on that. And then I'll wanted to ask also, and I'll just do both so we can save some time. In terms of resilience, so many communities have been focused on the impacts of climate change and the storms and floods and fires that are exacerbating some of the things that you talked about, Mayor Landrieu, in terms of inequity and vulnerability. But what are the parallels? Because they're linked, and we could have an entire session just on that, on the linkages of the increased temperatures and deforestation and such driving pandemics. But what are the linkages between climate action and pandemic action? And there's been several pieces out. And so I just wanted your comments on that. It's interesting and worth spending a minute on. So two different questions, but I'll toss them out and see. Maybe Mayor Landrieu, you want to go first? You're biggest on my screen. So
I'll go first with a great sense of humility, because I'm not an elected official anymore. And so this is just advice from, sitting in the bleachers on the third baseline. But Mayor Gelber is in the fight. But I would offer this on climate change first. Clearly, one of the sequela of climate change is going to be the large movements of people from one place to another that creates tremendous tension. That will be clearly true about the pandemic as well, depending on how other countries respond to this. And of course, it's going to inform whether countries close borders or don't close borders, and where there's scarcity of resources, who's going to get and who's going to give. And there could be violence attached to that in worst case scenarios. So I think we'll see some commonality there. I hope we don't get anywhere close to that, but it's something, of course, that we have to think about in terms of worst case scenarios. In terms of what's going to happen in the next couple of months, maybe the most important role that a mayor and a governor and clearly a president play is to prepare the people for what is to come. And we're about to go through a very, very, very dark 60 days in America that we have never experienced in our lifetimes. This will be World War I, World War II level traumatic events from the number of deaths that we are going to see and how we're going to have to respond to it. I have no doubt that the American people are not up to it. The most important thing here is to be very honest and very empathetic and try to prepare us for the difficulty of lost ones who will not be able to be buried by their family members, to be prepared to see body bags coming out of hospitals that get put in freezer trucks because there's not enough room. All of these things are going to be abnormal for us. Not that we can't steel ourselves to it, but I think we have to be walked through this in a very thoughtful way, honest, truthful, but in a way that really prepares the public for what is coming. We can respond to anything, but I'm very hopeful now as a result of the president and his team finally recognizing the severity of this and finally being forthright about the likely scenarios. They're beginning to prepare the country for what they think is coming our way. I think April 30th is too ambitious a day. I predict today that number will get upset based on the models that was shown by the University of Washington that are actually 60-day models, not 30-day models. And so I think that's the hardest thing for our leaders to do. But it is really critically important that they get the tone right, they get the substance right, and they prepare the public for what's coming, because it's going to be a very dark couple of months. But you know what? We're going to come out of the other side of it after we go through a fairly significant amount of pain and sacrifice.
Thank you. Thank you. Wise words. Mayor Gelber.
Yeah, first of all, the mayor is absolutely right about the movement of people. I was a federal prosecutor after Hurricane Andrew, and as African Americans from South Dade moved into Broward County, the uptick in civil rights and fair housing complaints was enormous. We literally put out lines for people to call in. There were so many coming because of that dislocation and the resulting sort of fear and anger and prejudice that was revealed. With regard to sort of the resilience and comparison of climate change, my city is, I think, probably way ahead of most. We really are far into our climate change adaptation. We're raising roads already. We're putting new systems in. The one thing, though, the one helpful point that has happened is that, the problem with government often is that it gets in its own way. And the way to get around that is to exercise your relationships and your cooperation and your collaboration.
Right.
And one of the things that has happened in our city is we've done so much with our county mayor and our city mayor next to us, so Mayor Jimenez and Mayor Suarez, as well as regional groups, that we're already exercised and working together on dealing with some of these resiliency issues. And it's definitely helped. I'm on the phone multiple times a day with the county mayor, going over different ideas. Same thing with my colleague, Mayor Suarez, who just got out of actually a coronavirus issue himself. So that's helped quite a bit. The last thing you asked about sort of how we prepare for it, at the beginning of this, it felt a little bit like whatever we did in the morning was groundbreaking, and at the end of the day, it was tepid. Whatever you did wasn't enough by the end of the day because the challenge came to us. One thing that's changed, however, is people see New York right now. They see a refrigerated, a cart out there taking in bodies. They see something that they could never have imagined in an American city. So our residents now have sort of, to say that they've peaked about this is an understatement. They realize that this is something that is that could be coming if we don't abide and adhere to these directives and we don't do a better job. So I think to a certain extent, while we are trying to give them a sense of calm, but seriousness about this, at the end of the day, what's happening in New York is letting them know that they need to very much listen to these directives, stay at home, respect social distancing, be very careful, have situational awareness. But I will say, from my perspective, what I try to project out is that, these notions that we are in this together and that we're going to get through it, to let them know that it's serious and they've got to do these things and they've got to do them conscientiously, but also to help foster a sense of calm about this. I give a message every 2 days, a video message, and I've given a lot of video messages since I've been mayor. None of them get the response that this gets because people are, alert to it and want to know. And I always end with, thank you for your patience and calm, stay healthy and at home. That's my message to them. And it's no matter what else I say, that's always going to be my message.
Yeah. Thank you.
And I would definitely to add to that, again, to support the mayor in this regard, to give some clarity to the folks on the phones that are listening. Besides the tone that he will set as a mayor and every other mayor, they're also pastors and rabbis in the sense that they actually will go to funerals. They will be on the phone with healthcare workers' parents who are worried about them, and in a very pastoral way, will help their communities get through this. Yeah. Those mayors are the ones that have cities that heal faster than mayors that, for example, will get afraid because the public might get upset with them. I was in office for 22 years, and I did some things that upset people. But the thing that people, even who are mad at me about making decisions, liked is that you always tried to be there when you could. Yeah. And there's a certain respect that's gleaned from that I would give to mayors to help, form what I would call, the courage pact, where even if you're making hard decisions, if you're there and you're on the ground and you're really in it, the public knows that and they pick that up. And this is where leadership really, really matters, from the president to the governors to the mayors themselves. It falls a little bit more heavily on the mayor's shoulders because they're the ones that are actually physically on the ground in solidarity with and in communion with the people themselves. And it's going to be really important for all the mayors of America and the governors to understand this in a very particular way. But it is a really hard thing to ask them to do because, they're working 24/7, 365. They don't really get a lot of rest in this particular issue. And so my heart goes out to them. And obviously I have the greatest respect for mayors who are on the front lines, as well as all the first responders who are in it every day.
Hear, 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 hear. Thank you. Let's turn quickly to some questions. We've had several come in that are focused on being ready for the natural disasters that are coming, heat waves, hurricanes, et cetera. But before we answer that, Mayor Gelber, I wanted to go to a question from Martin Vassallo, who is a reporter with Miami Herald, and he's got two questions. And given the fact we just have a few minutes, as briefly as you can answer, and I'm sure he knows how to find you. Do you feel like Miami Beach is leading Florida's fight against coronavirus? And is Governor DeSantis doing enough? That's the question.
It's my local reporter. Thank you, Martin. Okay.
He could probably text you.
No, I mean, I think we're leading for us. I mean, we're a different community than other places. And to me, the frustration has been that so many of the directives are a one size fits all. And I know my community is not one size fits all. I think all communities feel that way. So I do feel as though that's a significant thing for us. We're leading for our community. Whether it works somewhere else or not is up to that mayor or that, or whomever. With regard to the governor, I'll just say this. I have scrupulously refrained from saying anything about anyone else who's doing this other than that if I needed attention. And the governor of Florida has called me a handful of times, asked me what's going on, asked me to give him some information that he could use, and actually put stuff in executive orders that I wanted so that we could like close our beaches or do other things. So I feel like I've gotten what I need from this governor for my community.
That's great. That's great. Next question is from Megan Rowling at the Thomson Reuters Foundation. She's interested in, and this would go to both of you, if the work that you did to be more resilient under your Resilience 305 or in the Resilience Strategy of New Orleans, if those strategies made you better able to respond to this, essentially, is the question.
Mary, you can go first.
Okay, absolutely. There's no question that by getting together with all of my colleagues on a regular basis to deal with potential natural disasters, we are better exercised to work with one another. And just like sea level rise doesn't know political boundaries or geographic or municipal boundaries, this obviously doesn't either. So it's of course been helpful, and we're all benefiting from that.
Great.
I would ditto that. I call it building muscle memory. So when you're getting ready for a hurricane or you're getting ready for climate, you get into a battle rhythm, if you will, as the mayor said, of talking to your surrounding executives in Louisiana's position, it would be parishes. Y'all have counties. We're very different, but there's a communion of these folks talking all the time. I know Mayor Cantrell is constantly in touch with the parish presidents in the regional area. On top of that, because of having to prepare for this with the state, the governor's office of Homeland Security and the Homeland Security offices of the parish presidents are all in sync. So as a consequence, I'll give you one concrete example. When it became clear that the hospitals were going to become overrun and we had to open up a new facility in the convention center, which is a state entity in the middle of the city, all of those different organizations, because they had built muscle memory and gotten to know each other, were able to set that up in lickety-split time. And so, this is just another crisis. It's a massive one to respond to that requires a special preparation, but the mechanism of responding, the coordination, all of those things were built as a result of the work that was done around the issue of resilience.
If that is not a validation of that work, I don't know what is. That is edifying to the nth degree. Very, very good to hear that. We have come to the end of our time. We've got questions about urban and rural issues and the differences. We have questions about mental health and about the PTSD that we will see. And Mayor Landrieu, you essentially mentioned that as people are going to be traumatized coming out of this, as they were in our world wars. Some really thoughtful questions. I'm sorry we're out of time. I hope we could do this again. I want to end by saying thank you, profoundly thank you to both of you, and to say that The Adrienne Arsht Rockefeller Foundation Resilience Center recently launched Stories of Resilience, which is a series of inspirational, solutions-oriented stories of people around the world helping each other. And they'll be in your inbox once a week. Came out today. If you go to atlanticcouncil.org and search under Stories of Resilience, you can subscribe. We'd love to share them with you and for you to share your stories with us. Mayors, a profound pleasure. Thank you very much, and Godspeed, and stay well, and we'll be back in touch. Thanks so much.
Thank you, Mayor.
Good luck.